The upper trapezius is another really important muscle coming off of the clavicle all the way up to the back of the head there along the nuchal lines. And when it shortens and tightens and has trigger points, we tend to see its pain pattern coming into the temple and into the angle of the jaw, making it very important to be taken care of. A number of people that have told me they've worked this area manually find that it has the consistency of bone. I've heard it called myobone. Very oftentimes when those people have had me touch that area where they've been at, they've actually been working on the superior angle of the scapula, a common problem that a lot of people have. If we use spray and stretch, we don't have to worry about that kind of a problem. It is the most studied muscle because it's probably the easiest place to find a trigger point in. So that makes it a very important thing. Now, what do we see when a person has problems with their trapezius? Well, what we see are high shoulders, and that's going to restrict lateral rotation or lateral flexion of the neck. So that'll be a real easy thing for us to be able to test for. It's also the muscle that people tend to activate when they're under stress, especially in driving. I'll see people grab the steering wheel and hunch over the steering wheel and activate their upper trapezius. Make it a point when you're driving to learn to relax that muscle. That'll be very helpful. Other ways that it tends to be activated are by purse straps coming across the muscle. If the purse strap can be moved over the acromion and diagonally over the body, that will help to keep the person from lifting the shoulder to hold it back up and allow them to relax the muscle. Another issue with this particular muscle is people that today like to hold cell phones just like they used to hold the old phones right up this way. Again, another type of a problem that people have. The diagnoses that you might get with this, any type of a headache usually has some sort of an upper trapezius involvement. Shoulder pain and temporomandibular joint dysfunction almost always has an upper trapezius component. Let's go treat the upper trapezius. First thing we're going to do in taking care of the upper trapezius, we want to go ahead and test its range of motion. I will stabilize with one hand. The other hand is going to bring him into lateral flexion. An important thing about taking him into the lateral flexion is as we do this, we want him to kind of visualize his neck extending up here so we're not just crunching down on the nerves on the other side, and then make it a very easy, gentle pull to the side. And there we can see what his range of motion is going to be prior to the spray pattern. The next thing we need to know is the pain pattern itself for the muscle. The trigger point is usually down here at the angle of the neck, where the cervical area and the shoulder come together. What we're looking at is the referred pain pattern goes into the temple and oftentimes into the angle of the jaw, like in a temporomandibular joint dysfunction. So what we're going to do is put him into the stretch. We've already got him anchored on the side. We'd like this hand to come and cover the eyes. And what I'll be doing is spraying through the muscle and through its referred pain pattern, again, as the patient exhales. So deep breath in through the nose and exhale. And right through the jaw there for the first one. And again, deep breath in and exhale. And again, right up through the temple this time. And one more time, deep breath in and exhale. And again, you can see him taking up the slack as we do the spray and the increase in the range of motion. We're going to bring him back up. Following the spray and stretch, it's incredibly important to make sure that we rewarm the tissues. So we'll make sure to take the heating pad covering the shoulder, covering the neck, covering the side of the temple, and being able to get that rewarmed. I usually hold it until I can feel the skin beginning to become warm again. And when we're done, we just remove the heating pad, and then we're able to retest our range of motion following that. And again, we can see that we've gotten a very nice increase in range of motion here. Okay. And then to retrain the muscle, we hold down. And what I'd like you to do, your take-home stretch, is to pull the ear down towards the shoulder with a slight tip of the chin. And now we've got a very nice stretch going on. I want you to breathe in through the nose, out through the mouth about 3 times. This will help to reestablish the resting length of the muscle to its newfound increase in its range of motion. Following that, we're going to ask the patient, after one more deep breath in and out, to use his hand to push his head back up into position. Fantastic, and we can remove that. And then you can just actively bring your ear down to your shoulder and back about 3 times. So ear down to shoulder. And again, this re-educates the muscle so it learns how to function and stretch throughout its entire new resting length. And one more time there. Very important that the patient is actively involved. Great, thank you.